I've enjoyed right from the beginning of this research group, putting people together who come from really very varied backgrounds. We find that having that diversity of perspectives really enriches the science. So you can train, the computer by telling the computer this is a male person, this is a female person. Because if you look around our planet, humans seem to be very different to all other animals. We invent generatively. People who work in STEM, science, technology, engineering or maths, turn out to have more autistic traits than people who do not work in STEM. We've kind of got a responsibility as academics to make sure that knowledge doesn't just stay inside the ivory tower.
Hello and welcome. I'm your host, Sam Knowles. And joining us today is Sir Simon Baron-Cohen, Professor of Developmental Psychopathology at the University of Cambridge, where he also runs the Autism Research Centre. Simon has been working in the field of autism research for approaching 40 years and is one of the world's leading authorities on the subject. Since the mid-1980s, the research he's led and has undertaken has led him to advance several different and complementary theories of the condition, including the mind-blindness theory, prenatal sex steroid theory, and the empathizing-systemizing theory of autism and typical sex differences. We'll come back to all of those, I have no doubt. I think it's fair to say that some corners of autism research have, in recent history, had a shady and slightly disreputable reputation for their perhaps misuse of data, for drawing conclusions about the general population from tiny sample sizes that the data do not warrant. Indeed, it was in the wake of the MMR scandal that the charity Sense About Science was founded in the early 2000s to encourage researchers to present their findings responsibly and the media to report them responsibly. And of course, Sense About Science's director, Tracey Brown, as many will know, was a recent guest on the podcast. By contrast with this shady stuff, Simon's research has been a shining light of empiricism and evidence-based, data-driven truth, with sample sizes sometimes in the tens or the hundreds of thousands. His 2018 Empathizing-systemizing study famously collected data from 600,000 non-autistic people and 36,000 autistic people. Described by the medical journal The Lancet as a man with extraordinary knowledge, his passionate advocacy for a more tolerant, diverse society where difference is respected and cultivated reveals a very human side to his science. We are honoured to have him join us today. Simon, welcome to Data Malarkey.
Thank you very much, Sam, for inviting me, and I'm looking forward to our conversation.
Thank you. Now, it's great to have you with us. I trust that was a good summary of who you are and what you do. Is there anything that you'd like to add, anything I've got wrong?
It's a very kind, very generous description. So let's dive straight in.
Very good. Well, before we get down and dirty with data, I want to ask you a question that's designed to get to the heart of what makes you, you. And it doesn't necessarily ask you to tell us about the work that you do. So tell me, Simon, how do you spend your time?
Okay. Well, you mentioned in the introduction that I run the Autism Research Centre. So my kind of day job is probably, 90% research. The Autism Research Centre is about 40 people at the moment, working at varying levels of seniority, from research assistants to PhD students to postdocs and senior research associates. What's quite fun is that it's very multidisciplinary. So, I've enjoyed right from the beginning of this research group, putting people together who come from really very varied backgrounds. So we have psychologists working alongside geneticists and neuroscientists and epidemiologists and clinicians, quite importantly. And what we find is that they kind of start off speaking different languages. But if you kind of put them in the same office and you expose them to just kind of joining in seminars together, actually they start learning each other's languages, they start collaborating. And when it comes to trying to understand something as complex as autism and what autistic people need, we find that having that diversity of perspectives really enriches the science.
It sounds like a fantastic community. I'm reminded maybe 20 years ago I visited when I was thinking about doing some postdoctoral research in psychology. I visited the MRC Cognition research unit also in Cambridge, and I'm aware that they had a rule there that if you weren't actually running an experiment and you weren't on a call where you were in the building, you had to go to morning coffee and afternoon tea, and that this big expanded community of many different psychologists would have to go and have tea or coffee. They didn't have to drink tea or coffee or eat cake and biscuits, but they often did. But that would lead to this sort of spontaneous kind of clashing together of worlds. And it sounds like at the ARC, you are also, you're maybe not with the coffee and tea rules, but you are also encouraging this multidisciplinarity.
Yeah, we actually sort of took advantage of the pandemic because we used to have sort of monthly seminars, but then we kind of moved them to weekly, and we made them hybrid so that no one would feel isolated. But it also opened up a pool of potential speakers for our group because suddenly we could invite anyone from around the world who was doing relevant research to come and talk to us. And that's continued. So it's one of the kind of benefits post-pandemic that we meet every week. It's not the same as the MRC unit you described of morning coffee every day, but we're respecting that people work best in different arrangements, but nevertheless are encouraging people to come in at least for this kind of very well, it's an opportunity really just to bump into each other in person, to have all those corridor conversations, and to sort of get together around listening to a piece of ongoing research.
Fantastic. And I'm always encouraged to hear good things that come out of the pandemic. So many bad things came out, but that's a very, very good legacy for your unit. Tell me, Simon, if you would, what first got you interested in autism?
So I studied a degree called Human Sciences at Oxford. And after I graduated, I heard about a job as a teacher in a small unit for autistic kids. And I thought this sounded interesting just because it would allow me to kind of combine my interest in how the mind works, because I'd particularly focused on psychology within human sciences, but in an area where there was an opportunity to have some kind of impact, real children's lives, and trying to make some headway into understanding what do these kids need. And satisfying, I guess, a scientific curiosity of what's different about children and adults who are autistic, but also how can we translate research into practice. So that sort of that was a really stimulating year. It was working in a small unit, just 6 children and 6 teachers. So it was there was an inspiring head teacher who'd set it up to be one-to-one in terms of teacher-pupil ratio, and very experimental because we didn't know much about what would be helpful. It worked very closely with families. So the teachers were in close contact with the parents to really understand these children who see the world very differently. And at the end of that year, I decided, this was really fascinating. And I went off to do a PhD at UCL.
Very, very interesting. And I mean that role of or the opportunity for science not to be kind of basic and non-applied, but to be applied, I can see being a huge draw. And I first came across your work. I was doing a master's in experimental psychology at Sussex about 25 years ago, and your book, The Essential Difference. Can you talk to us a little bit about the empathizing-systemizing dimensions and that theory of autism that you developed?
Yeah, because back then, the field of gender differences or sex differences in the mind was mostly focused on, I guess, on the one hand, visuospatial skills, which were meant to be sort of stronger in males on average, and then verbal ability, which was meant to be stronger in females on average. But I was sort of coming at the area of gender differences because I was working in the field of autism. We just talked about that. And autism tends to be diagnosed more often in boys than girls. Back then, it was about 4 males for every 1 female. These days, the gap has narrowed a little bit as more girls and women are getting diagnosed, which is very good. But it's still about 3 males to every 1 female. And I was kind of curious as to why were males more likely to end up with a diagnosis of autism. I also kind of wanted to connect what we knew about the profile, the cognitive profile of autistic people, with the field of sex differences or gender differences. And it didn't strike me that, we were looking at the right dimensions. Although language and spatial ability, they are important, I just wondered whether we were missing something. And I'd been looking in autism at social skills, and particularly what's called social cognition. So the ability to understand other people, but also specifically other people's minds. Sometimes it's referred to as theory of mind, being able to imagine what another person is thinking or feeling. And I think that kind of comes under a broader umbrella of empathy. So I kind of looked at the literature on whether there were any gender differences in empathy, and we started looking at that. But the other domain of the mind that we were looking at in autism was what I called systemizing. So systemizing is defined as the ability or the drive to analyze a system, any system, where systems are defined as things that follow rules or patterns. So it's quite an abstract definition, but it would encompass things like mathematics or music or chess or the weather or the technology that we're talking through right now, digital systems. And I was looking at these because when we were meeting autistic people, often we were finding, strong interests or even talents in understanding systems, but nevertheless some difficulties or struggles with understanding people, and particularly the mental states of other people, their thoughts and feelings. And so we kind of looked at autism as potentially an extreme of the typical male pattern of development. So irrespective of the gender of the person, we were saying, if you are autistic, is it the case that you may struggle with some aspects of empathy, particularly what's called cognitive empathy, or being able to imagine the thoughts and feelings of another person? But alongside that, might you have an aptitude and an ability to understand systems and patterns in the world? So that's what we kind of set out to study, and we did this by developing some questionnaires. The empathy quotient is one of them, and the systemizing quotient is another. These are self-report questionnaires, so people can just answer how strongly they agree or disagree with a statement about whether they can easily tune into what someone else is thinking or feeling. So that's on the empathy side of things, or whether they have a strong interest in patterns and systems, like how computers work, or as another example, spotting patterns in numbers. And that study that you referred to in 2018, it's come, we're jumping way ahead because the book The Essential Difference was published in 2003. But we'll just kind of jump ahead to a big online study, because many of the earlier studies were smaller. And I know your podcast is particularly interested in big data. But the 2018 study, we were able to sort of put those questionnaires up online and get 600,000 non-autistic people to take both questionnaires, and also 36,000 autistic people. And, people can look up the results, but we did find gender differences, quite robust gender differences. We have to be very careful when we talk about these results, because scientists who are listening will know that we're just talking about group averages. But some listeners may sort of mistakenly conclude that we're talking about findings that apply to all women or all men, but they are just, overlapping bell curves in the population. But we found that on average, females scored higher in terms of empathy compared to men. And on average, men scored higher in systemizing compared to women. And when it came to autistic people, they seemed to show an extreme of the typical male pattern. So scoring below average on empathy and above average on systemizing. So I've kind of wrapped all this into a theory. You mentioned it, but it's called the empathizing-systemizing theory. And it's simultaneously a new way of looking at gender differences, but also hopefully a helpful way to understand autistic people, that they have a different kind of mind. And actually, I think it's very compatible with what we call neurodiversity these days. That minds are different in the population. We can only really look at group averages, but autism seems to represent one of those styles, cognitive styles, and other kinds of groups in the population, like the genders, but not limited to that, also show different profiles when you have big data.
I want to come back maybe a little bit later to talk about employment in the world of work and the role that people with autism can play, but are often excluded from playing because of recruitment procedures and interviews and the rest of it. But just to dwell a second on systemizing, the psychologist in me will feel that your 600,000, 36,000, no problem with statistical power there. I can see absolutely none whatsoever. But I was taken also by your 2021 book. Great! It was a great. I remember getting it. I think it was yet another lockdown, and it was a. When I got it, it was a glorious summer's day, and I just sat in the garden and read it and enjoyed it hugely. And then, of course, read it at greater leisure. But in the Pattern Seekers, you talk about the development of the systemizing module in the human brain around 70,000 years ago or so, designed to seek out these if and then contingencies to help us make sense of the world. Could you talk to us a little bit more about that?
Yeah, sure. So I'm glad you enjoyed the book. So the Pattern Seekers was both, for me, an opportunity to celebrate autistic people and their contribution to human progress. But it was also kind of taking on quite a big challenge, which was a new theory of human invention. Because if you look around our planet, humans seem to be very different to all other animals in that we invent generatively. We don't just invent kind of once or twice, which you do see in other species. So if you look at chimpanzees, for example, they might be using a rock as a hammer to crack a nut. And that's quite common in many species, simple stone tools to maybe to help with obtaining food. But I think that what you see in other species doesn't seem to have that same quality of being able to invent generatively. And in the book, The Pattern Seekers, I argue that what's sort of special about the modern human brain is it's got this mechanism called the systemizing mechanism that can look at information to try and spot these special patterns, which you just named, if and then patterns. So if I take something and I do something to it, then I get a particular outcome. Engineers call it input, operation, output. So you take something as input, you perform some operation on it, and you see what happens. And I borrowed this logic from a logician called George Boole in the 19th century, who was kind of putting forward an account of logic. But, the argument is that in the human brain, and not in other species, we have a mechanism that can spot these patterns. And it's not just to kind of detect the patterns, but it's also to start playing with the patterns. Because you can either vary the if or vary the and then you'll get a different then. And that's what I argue is at the heart of human invention. If you've got this capacity, the ability to invent isn't limited to a one-off opportunity. You can use this same ability in multiple domains or types of information. So you asked about sort of the evolutionary side of things and the evidence, if you like, from the archaeological record. Goes back about 70 to 100,000 years, that suddenly you see modern Homo sapiens not just inventing simple tools like a rock to crack a nut, but inventing the first jewelry, which was a necklace made out of shells that had little holes drilled into each shell. So if I make holes in the shells and I thread a string through the holes, then I will have a necklace. We see the first bow and arrow, which is a kind of complex tool. The earliest musical instrument, which was a flute made from a hollow bone of a bird. But it's the same if and then logic. If I take a hollow bone and blow down the bone and cover one hole, then it makes a particular note. But if I blow down the bone and cover two holes, then it makes a different note. So we see kind of human beings inventing, I call it generative invention. It's kind of unstoppable because we see the first sculptures, the first cave paintings, the invention of sewing, and then if we come more recently to 12,000 years ago, the agricultural revolution, what seems to be special about us is that we just can't stop inventing. We were inventing vaccines during the pandemic to bring it right up to date, and that's just what characterizes us. And what we did in that big study, just to kind of loop back, was we looked at the general population, and also gave them another questionnaire which measured autistic traits. We call it the AQ, the Autism Spectrum Quotient. What we found was that people who work in STEM, science, technology, engineering, or maths, turn out to have more autistic traits than people who do not work in STEM. And that was, a nice demonstration that there's a link between how many autistic traits you have and your aptitude to understand systems, because science, STEM is all about understanding patterns and systems. And then we took it to a kind of a deeper level by working with a company called 23andMe, which is a personal genomics company. So they were asking their customers to not just provide a saliva sample so they could look at their DNA, but also to take the systemizing quotient, that questionnaire. And we found a really interesting genetic overlap between genes associated with autism and genes associated with aptitude in systemizing. So even in our DNA, the data was telling us that there's a link between autism and the human capacity for invention. And we've got other kind of data which speaks to this. We conducted a study in the equivalent of Silicon Valley, which was in the Netherlands, in a city called Eindhoven. Some of your listeners may know that Eindhoven is it attracts people who are good at systems thinking because it's had the Philips factory there for over 100 years. And it's also got the Eindhoven Institute of Technology, which is a bit like MIT. So people who are good at patterns and systems have been moving there for over 100 years and meeting and starting families. And in order to test that idea that maybe people who have an aptitude in understanding systems might have a genetic increased likelihood of having an autistic child, we simply looked at autism rates in Eindhoven compared to two other Dutch cities that haven't been, if you like, IT hubs. They haven't been attracting strong systemizers. And we found that autism rates were more than twice as high in that city, Eindhoven, compared to Utrecht and Haarlem, which were matched for kind of various demographics, but were not sort of attracting people who are good at pattern recognition. We could have done the same study in Silicon Valley, but I think it's further away. But I think it needs to be done as a sort of, if you like, a replication of that study.
It must be so satisfying to have both the hypotheses and then the experimental, but then you've got the overlay of the genetics with 23andMe and then the Eindhoven study. It must be so satisfying. Talking about, I wasn't going to ask this question in this order, but that's the nature of the generative brain, I guess. Talking about generative innovation and invention, I wonder how you feel about the sudden. I mean, I know that AI tools, include Excel and Word, but the sudden widespread availability of AI tools that can do some really interesting things with data and statistics and coding. I just kind of wonder, kind of how you feel. Do you feel optimistic, pessimistic, excited, terrified? Are you and your team making active use of these tools to kind of crunch through the big data sets that you're working with?
Increasingly. So I'm fortunate to be surrounded by talented scientists, and some of them are using machine learning to look at the human brain. So it's one tool that's available for making sense of MRI data, for example. Or genetic data. I mean, you can apply it to lots of things. I mean, I'm sort of, I mean, there are some interesting studies definitely that are coming out. We talked earlier about sex or gender differences. And these days, machine learning or AI is being used to try to identify the algorithm that could classify a brain as male or female. So you can train, the computer by telling the computer this is a male person, this is a female person, and feed the computer lots of examples whilst it finds its way through the data, and then you can sort of test the algorithm to see how accurate it is. By this time, not telling the computer the sex of the person, but just letting them use the neuroimaging data. And it's turning out that some of these algorithms are over 95% accurate in classifying, as it were, new brains based on what they've learned from previous brains. So I think there's a lot of opportunity, but I'm also kind of cautious. There's a kind of old saying that junk in, junk out. Depending on what you sort of feed your artificial system, you may get information that's actually not very meaningful.
I think your caution is well placed. There's an interesting guy called Colmer Shea in NYU, may or may not have come across his work, talking about the difference between convergent thinking and divergent thinking. That the large language models are brilliant at doing convergent thinking, but not so good and certainly not so human as we are in this generative way that you describe. But the other thing being that the more work that these large language models do, the more prompts they respond to, the less human the responses are getting, and the more AI-like they're getting, because they're using the bank of responses they've already generated. And I'm fascinated to see that. I don't suggest that either you or I will crack that conundrum. I wanted to talk a little bit about I've always found your work in your, if I may call them that, your popular science books, but also in your kind of your kind of peer presentations. We found your work to be very approachable and your explanation of your science to be very straightforward to follow, even if it's often, as we've heard in the last half an hour already, very rich and deep in its complexity. You clearly put a premium on explaining your work to the widest possible audience. Can you tell me why?
Well, I think at a personal level, I quite enjoy thinking about how to communicate the findings to a variety of audiences, because it's very easy to get kind of sucked into, if you like, an echo chamber of people who just work in one very niche area of science, where they can talk to each other using jargon, but it becomes impenetrable to people outside of that niche. And assuming that the general public, is intelligent, but they just need the jargon removed, it becomes an interesting exercise to just see whether you can communicate the main findings, bring out what might be of interest to your listener, but without sort of cluttering it with unnecessary jargon. And I think, we've kind of got a responsibility as academics to make sure that knowledge doesn't just stay inside the ivory tower, inside universities, because these days there's a real opportunity to use knowledge or research coming out of academia in all kinds of places. We talked earlier that we bring clinicians into our research centre so they can think about how to apply the research to clinical practice. But we can do the same thing with teachers to think about the application to educational practice. You mentioned earlier, employment practice. And, maybe this brings us back to autism, because it's sadly the case that 85% of autistic adults are unemployed, which is it's a bit of a kind of contradiction when we talked earlier about their talents in understanding patterns and systems. So clearly there are barriers to autistic people getting into work, or maybe if they're lucky enough to get a job, keeping the job. And these are probably not to do with an absence of ability or talent, but more sort of how we've designed the workplace to suit the majority. And maybe we've placed too much of a premium on things like social skills and communication skills, and adaptability to a very rapidly changing workplace, when autistic people are going to struggle in exactly those areas. So inadvertently, we've created workplaces which are discriminating against a group of people with a very specific disability. And in other areas of public life, we do as much as we can to try and guard against discrimination. We put in wheelchair ramps to make sure that people with physical disabilities still have access to the workplace. But we're not really yet, I don't think, doing the same for autistic people, that there are all kinds of invisible barriers, even when it comes to, recruitment and selection into work, that we may be kind of creating a very uneven playing field. And if we want to do anything to sort of redress the balance so that autistic people who have a disability but also have a different kind of mind have equal access to the workplace, we're going to have to sort of examine our practices. So when I write these popular books, I suppose what I'm also motivated to do is not just write for fellow scientists, but also write for employers or GPs or nurses or teachers. Because otherwise, how is the research going to ever make social change?
I'm very inspired to hear you talk about kind of the knowledge exchange, knowledge transfer, the area of getting genuine real world impact in clinical practice or education or employment. My wife and business partner runs a consultancy that specialises in academic impact for the REF, the 7-yearly Research Excellence Framework, and so I'm exposed to lots and lots of work that she's doing in many different institutions. If you were in charge of the world of work, Simon, you're going to make the world of work as friendly for autistic people as it has become. I mean, I know it's not entirely friendly, but as it has become for people with physical disabilities. Are there three? I mean, it doesn't have to be three, but let's say three things that you think the world of work could do better to really capitalize on these brilliant systemizers.
Okay. I mean, I always like a challenge, so here goes. I mean, I've been fortunate to work alongside a company called Auticon, which stands for Autistic Consultants, and they only hire autistic people, and they particularly are focused on autistic people with coding skills. But actually, I think their practice could be generalized to other sectors. But basically, one of the lessons is, let's make sure that the interview with the candidate for a job doesn't just focus on, does the candidate make eye contact, or is the candidate reading the room, which are kind of social skills. Let's give the candidate a task which reflects what the job is actually going to involve. And they sometimes use Lego to see what the candidate might do with Lego in terms of, finding a solution to a problem. And they're kind of setting aside, how much eye contact the person makes or how conversational they are. And they just look at how do they solve a task. If it's, if the job requires, excellent attention to detail, give them an interview task that's all about, spotting proofreading mistakes or whatever. And you might find autistic people excel in it. So, it might be the first step might be at the level of the interview. I think a second, maybe message to employers might be that if you have an autistic person in your workforce, it doesn't cost you much to simply ask them, what do you need? Because autistic people might surprise you by telling you, actually, we just need small adjustments to make our lives much more comfortable. For example, knowing that I'm always going to sit in the same chair every day, if it's a hot desking arrangement. For some people, it's fine to be in different positions every day, different places each time you come in. But for an autistic person, they often prefer predictability and routine, and that lowers their stress levels, and then they can get on with their work. For another person, it might be, wearing noise-cancelling headphones, so that if they are in an open plan office, they don't have to get distracted by the background chatter, and they can concentrate on the work that needs to be done. Or they might say, please don't expect me to come to lunch or come to the pub after work, because for some autistic people that's really stressful. So it's just kind of making these small adjustments based on asking the person, what do you need? And it may not affect the employer's bottom line, as they call it, their overheads, or the amount of kind of funding that needs to go into supporting a person with this kind of disability, because these are kind of small changes, but it may make a big difference to whether the person's mental health is thriving or deteriorating.
Excellent. Excellent. I love that. I love the small changes, big difference, and really, I mean, as you say, if any company kind of stopped and thought about it, when was their bottom line affected by people turning up and getting drunk at the office party or not? I mean, the answer is clearly never. Very, very straightforward and pragmatic. I wanted, as we moved towards close, I wanted to ask you a couple more questions. One is, I wondered if you could, given that you are at heart an evidence-based person who's looking for these different strands bringing together. I wanted to ask what if there were examples of kind of egregious examples of the misuse of data that you've observed from your perspective over the course of the last 30, 40 years. Are there any in the public eye, in academia, in medical practice? Are there any examples of the misuse of data that really stand out to you?
Yeah, that's a great question. I think my sense is that things are improving, but I've seen sort of scientific standards improve over the last 30 or 40 years, certainly in my field. So, I'm as guilty as many psychologists back in the 1980s or 90s of doing quite small scale studies. But in those days, it was considered to be publishable and good science to do a study of maybe 20 autistic children and 20 non-autistic children as the control group. Today that wouldn't get published. So in a sense, our standards are changing. The scientific journals that become the sort of, if you like, the metric of what is good science. They've changed. What the expectations. There's the so-called replication crisis in science, particularly in psychology, has led some journals to say, well, actually, if you want to get your paper published in our journal, you need a replication cohort. It's all very well to find an effect once, but can you as the scientist replicate it before we ask independent labs if they can replicate it? So replication is at the heart of science. We can come up with all kinds of interesting findings, but if they don't replicate, can we really sort of have confidence in them? So I haven't really answered your question in terms of pointing the finger at a specific, example of maybe bad practice. You mentioned the MMR scandal early in this conversation, and I still remember that, and certainly I think it did set back our field of autism research probably for about 10 years. And it was based on quite a small sample. Andrew Wakefield publishing in The Lancet, a relatively small scale study, that children who'd received the MMR vaccine, often seem to develop signs of autism very soon after the vaccination. And that caused a kind of public panic amongst lots of parents not to vaccinate their child. But also it set the field off into a direction where they then had to either prove or disprove this theory that the MMR vaccine, measles, mumps, and rubella vaccine, was causing autism. And it took about 10 years to disprove it, and a lot of money. But it turned out to be, I suppose you could argue that in some areas of science, you do need to go down a particular road to falsify a hypothesis, not just to confirm it. But there, it led to studies, for example, looking at large populations where half the population had been vaccinated and half hadn't, in places like Denmark and Japan, and comparing autism rates across the two halves of the population and actually finding no difference. So it sort of disproved the theory using big data, but it takes time to disprove it. And along the way, lots of parents had stopped vaccinating their children, and as a result, the rates of measles went up quite dangerously high. So it was at some cost.
I live and work from the People's Republic of Lewis, East Sussex, just near Brighton, and there are many things I like about this place. And one of the I was living here in the wake of that scandal, and feeling hugely frustrated at maybe particularly the BBC, but the need for balance, to have editorial balance of somebody who had an opinion and a belief versus science. And I'm sure you were involved in many of those frustrating debates. But of course, in Lewis and Brighton, there was this dip below herd immunity. There was this rush away from vaccine, and some very serious cases of measles. And I know that there were some deaths as well. So I absolutely feel that. I mean, I mentioned in the introduction, I mentioned Centre About Science being set up in the wake of that, and I think they've done some really interesting work. When we had Tracey on, she was talking about the All Trials campaign, which I think is another campaign that you talk about, kind of academic journals improving. And I wasn't aware, actually. It's a while since I've been publishing academic papers, but I wasn't aware that many journals are now saying you need to have a replication cohort. I think that is a net positive, even if it's come out of some bad science that's been published before.
Yeah, and I think particularly in the field of human genetics, we're seeing journals have that as a prerequisite, just because there were too many decades where findings weren't replicating. So, the editors are taking a kind of sensible and cautious approach, and asking the authors, the scientists, the researchers themselves, let's see if you can replicate your own work in an independent sample.
Great stuff. Now I have to have a Columbo question. You may remember Peter Falk, Columbo. He would always have just one more thing. I wanted to ask you: is there any way? I mean, I'm sure there are many ways, but is there any particular way that you work with data, and you use data to inform your work and inform the field, that I haven't asked you that I should have done?
I think that increasingly there's data integration that from many different sources. So I talked earlier about how in our lab we have, for example, neuroscientists sitting in the same room as geneticists, and we've seen some exciting kind of outcomes of two scientists using very different kinds of data, learning each other's language, and then integrating the data to be able to come up with new insights. So, for example, looking at genes associated with different measures of the brain. That really needs a neuroscientist and a geneticist kind of sharing data and figuring out how to integrate it. A second example in our lab, relating to the gender differences we spoke about earlier, is to work with people studying hormones, endocrinologists, but particularly, finding imaginative ways to measure hormones like testosterone and estrogen in pregnancy, because we know that these hormones shape brain development, to see what it predicts about child development and beyond. And it's allowed us to not just have psychological data, for example, about empathy and systemizing. We spoke earlier about that, or questionnaires about how many autistic traits do you have, but also to look back to see whether that's related to your exposure to different hormone levels. So I don't know if it quite answers your question, but it's about kind of data integration. And these days, the barriers are coming down between sciences. That there's a kind of a push to not work in silos and in departments, but to really focus on a research question and think, what tools do I need, and what expertise do I need from colleagues to answer a question.
In a much less rigorous, much less scientific way, I do quite a lot of work with companies, but and also with academics and charities and government departments sometimes, on insight and on innovation, and getting the cross-functional team together, getting people from different perspectives, ensuring that R&D are talking to finance and are talking to human resources and are talking to communications, As you say, they speak different languages. They speak much less defined languages, clearly, than in academic discipline and rigor. But actually, it's great when diverse people, including neurodiverse people, but when diverse people are put to try and solve different problems together. I find it inspiring to see the way that something that someone has used in human resources can suddenly unlock something in research and development.
And actually, just picking up on your comment about including neurodiverse people, particularly in the research environment, that's become another big change in the way we do research. That whereas 30 years ago, it was scientists, often non-autistic scientists, studying autistic people, from this kind of, I don't know, it's kind of almost a perspective of observation rather than inclusion. Whereas these days we're very keen to have autistic people in the team, whether they have a science training or whether they can simply kind of improve on a study design by giving us their feedback through what's called community engagement. It's a very different way of doing the research to make sure that the research is meaningful to the community that you are studying and serving. And I think the other thing that's really changed is it relates to sort of my motivation for why I do research, really, which is that where possible, we want to do research which doesn't just sort of answer a puzzle, but also can change the world for, in this case, autistic people. So we've been looking as an example at mental health. And sadly, the majority of autistic people have poor mental health, very high rates of depression and anxiety, and even more alarmingly, high rates of suicidality, sort of feeling that life isn't worth living, and maybe even planning or attempting suicide. Cambridge, where we both have an affinity, are quite worried about this amongst its students. I think we lost 6 students to suicide last year in Cambridge. But autistic people, it turns out, are at an increased risk of suicide. So our research into kind of mental health, it's prompting us to make sure that we don't just publish it in the academic journals, but we make sure that the data gets into the hands of policymakers in the Department of Health. So we're working quite closely with, for example, the Department of Health and Social Care to change the UK suicide prevention strategy to have a much closer look at autistic people and what the risk factors are, and hopefully also the protective factors. So it's just a way of making sure that science remains relevant.
Very, very, very inspiring to hear impact in action. Finally, Simon, where can our listeners find out about you and what you're up to at the Autism Research Centre online and social media and so on?
Yeah, so our website is a good place to start. It's autismresearchcentre.com. We encourage autistic people who might be listening to sign up if they want to take part in research. Big data means we need people from all walks of life, and also because the spectrum of autism is quite wide, we need to include people with a very wide range of co-occurring conditions. Some autistic people, for example, also have learning disability, but some don't. Some have dyslexia, some don't. Some have language difficulties, some don't. So we really need to kind of have a very diverse pool of people that work with us to make sure that we're not just focusing on a small subset, but we're getting the big picture.
Very good. Well, we will include links to that in the show notes. I want to thank you so much for your time, Simon. I think it's fair to say if there were more people with your approach to using data smarter, particularly in taking its impact from academia into the real world, there'd be rather less malarkey in the world of academic research and rather more data-driven common sense. So Simon Baron-Cohen, thank you so much for joining us here today.
Thanks, Sam. I've really enjoyed chatting.
Thanks so much for listening to Data Malarkey. To find out what kind of data storyteller you are, why not take our data storytelling scorecard? It takes just 2 minutes to complete and will give you a personalized report right away. Visit data-storytelling.scoreapp.com or follow the link in the show notes.